Okay. Stop share करूँ ना मैं?
Stop share. Yes.
Okay.
Good.
Okay, sir.
ताडे सर आले का?
Yeah, thank you, sir. Ale.
Okay, sorry.
Should we start?
Yes, yes.
Namaskar. Maharashtra University of Health Science and Mumbai Vidya Sabha. Welcome our today's speaker, Dr. Devika Deshmukh, respected doctors, teachers, students, and honorable citizens. We wish you all a very happy new year. I am Ved Mehta, and I cordially invite you to join a detailed, well-studied, and informative lecture series, Charak Nirupan. So first, we'll start with Dhanvantari Vandana. Om Piyushpani Sakrita Kundalam Chaturbhuja Charu Vishala Netram Sarup Jananam Sukha Shanti Dayanam Dhanvantari Twam Shirsana Mamaha Udumita Vishana Jalodhara Bhara Bhugna Shocham Dasha Mopagatas Juta Jivitasha Twada Pada Pankaj Rajamrita Dikta Deha Martya Makarat Dhojarupi Tulya Rupaha मृतपाय व्यक्ति को भी मकर ध्वज समान रूप देने वाले भगवान धन्वंतरी को नमस्कार करते हुए हम आज के सत्र की शुरुआत करते हैं. Well, friends, we have with us Dr. Devika Deshmukh. She is from Mumbai. She is MD in Panchakarma. She is CMT and HE from USA. She is affiliated to many prestigious organizations. She is BMS and MD Panchakarma from SDM College of Ayurveda and Hospital, Hassan. She is certified massage therapist and health educator at National Holistic Institute, California, USA. She is registered Master Ayurvedic Specialist Association of Ayurvedic Professionals in North America. She is working at Vyaapad, Mumbai as Chief Physician and Panchakarma Consultant at Kerala Ayurvedic Clinic, Mumbai. She is Brand Ambassador of Association of Ayurvedic Practitioners of North America. She is online webinar faculty at International University of Yoga and Ayurveda, Florida, USA. She is admin member with CAR, that is Council of Ayurveda Research, USA. So we have with us very studious and a very perfectionist Dr. Devika Deshmukh with her subjects Sanshodhan, Karma, VidhiNishedh, Vyaapad, and Marm, Vichar, Vivechan. So over to you, Dr. Devika. Thank you. So, Dr. Devika, I'm sorry.
Thank you, Dr. Mehta. Thank you for introducing me. Should I be sharing my screen or is that from your side and should I also share from my side?
You may share.
You should.
Okay. Are you able to see the screen?
Not yet, madam.
Not yet. Okay, I will share it now again. Okay.
Yes, perfect.
All right. All right. So I will make this into yes. So my today's topic is Shodhana Karma VidhiNishedh Vyaapad Marma Vichar Vivechan. So what happens when Shodhana VidhiNishedh or complications that occur when Shodhana Vidhi is not occurring properly? And how are we going to correlate that with marmas in our body? So first, directly jumping to the complications that arise because of Vamana Vireshana or Sanshodhana Karma Nishedh. So let us go with the contents. Shodhana Vyaapad and its management is what I'm going to talk first. Then we are going to look upon marmas. Then we'll go with classical clinical significance of it. How do we correlate and take care of it? And what are the role of marmas during Panchakarma procedures? The 10 complications that arise because of emesis and purgation mainly, as per Ashtanga Sutra 18, is, as we all know, it is Adhmana, Parikartika, Srava, Rudgraha, Gatragraha, Jivadana, Vibramsha, Stamba, Upadrava, Klama. These are the 10 most important ones. They arise because of either ayoga or ati yoga of Shodhana Karma. Either less of purgation, less of emesis, less of Shodhana karmas, or doing it in Ati Matra. We will take one by one and go about its management. After explaining the management, then I will correlate it with what Marma care can be done. The three types of purification according to its signs are Samyak Yoga, Ayoga and Ati Yoga. So Samyak is when optimum action of the karma that we are doing happens. We get Samyak, Swinna, Snigdha, Vamana, Virechana, Nasya, Basti, Lakshanas. Ayoga is insufficient elimination and Ati Yoga is excess elimination. The complications below, which are considered as Ayoga, as they do not show adequate desired action, is when, that is mainly when, if there is scenario 1, if the medicines administered for Vamana or for Virechana in a patient does aggravation or excited kapha with it. So this will act as Vamana. Because Vamaka medicines, the Virechana medicines are when kapha should be at the least. But in case if kapha is excited, then these Virechana medicines will act as Vamana medicines. So if the medicine does have a bad smell that the person is taking and they throw up. So make sure that whenever you are I will always correlate it with what happens practically, because that is what my specialty is. And I've been practicing for the past 11 years. What we always do is, whenever you are giving a medicine which is meant for Virechana, and if it has a very unpleasant odor or something that will cause emesis, then give something else like lemon or something orange for the person to smell, or maybe even ground coffee to smell. That will take care of the taste of the smell, sensation of smell. The drug, if the drug is not wholesome, if they are large quantity of medicine and they are not able to gulp it down the throat, or even intake of medicine before previous meal is digested, then Virechana medicine will act as Vamaka medicines. In scenario 2, we see that if the medicines administered for Vamana, which cause Virechana, will be under these following symptoms, following conditions. If Vamana is performed on an individual who is hungry, that is why always Vamana and Virechana timings are specific and we need to stick to those. Vamana medicines are given in the early morning times when kapha is at its highest level, when you are, your previous meal is digested. And Virechana medicines are given on a different kind of, you have to see the koshka. But Vamana should not be performed when a person who is very hungry. Otherwise, they will digest the medicine and it will come down as Virechana. An individual with Mrudu Koshka, then you have to take care that you have to give only subtle or mild Vamaka medicines. Because if you give Tikshana ones, then it will come down as Virechana. An individual will list kapha in the body if the medicine is Tikshana or penetrating, and if the medicine is irritating to the upper GIT. So these cares need to be taken to prevent Ayoga. Complications of Parikartika. Now let us go with Parikartika. Potent purification medicine is properly, if a potent, that means Tikshna medicine is given in a properly oleated patient with Guru Koshta and Ama dosha, or in lean bodied person with Mrudu Koshta and less strength, and Bala is less. Then what happens is the dosha reaches the rectum or Gudha in Ama condition and get expelled out immediately, resulting in Parikartika or fissure. With severe pain, or if there is even blood, how do you manage that? In whichever Ama or Sama conditions mainly, or Ama dosha, you have to go with Langana Pachana Rukshana. That is why in Sanshodhana Karma, to avoid complications, we always give for first 3 days either Chitrakadi Vati, Agni Tundi Vati. These are all Hingu Vachadi Vati. These are all Am Pachak. These are all that will take care of your Agni. All of these are very important so that Agni is preserved mainly. Or rather, the medicines that you will be given for Sneha Pana are digested easily. So management always has Langana, Pachana, Rukshana slightly, with Laghu Ahara. For those whose body is emaciated, in the sense in abala, less bala people, Brahman and Madhurasa dominance, Ahara should be given. Here you can see that Guda or this marma, Guda is a Sadhya Pranahara marma is targeted. So make sure that whenever complications, to avoid complications like parikardika, you take a good history of the patient before. If they have had any, before they have had a fissure, so that if that is the thing that you have to definitely consider that before administering the medicines for Vivechan. If parikardika still continues after ama is digested, then what do you do? Go for amla taste. For increased vata, give ghee medicated with pomegranate juice. So it can also be Dadima Nigrutha, Pushpakasisa and other formulations. The powder of skin of Dadima along with sour curd is one of the best things that you could easily make and give, which is written in our Samhitas. Paste made up of devadaru, tilla or hot water. Or picha basti could be something which is very mild. It is also shown in Arsha Roga. So picha bastis can be given with Shitaviri ingredients. Or sneha basti with yashti madhu tella. Why? Because you need to heal the fissure first before going ahead. Otherwise, now this complication can also further down drain to Jivadana. That is a latent complication of it. So complication of parisrava, discharge and its management. Next is parisrava. If we see these complications, then it either points to vata dosha increased or pitta dosha increased or kapha dosha increased. If we can easily identify which dosha has increased leading to this complication, then that dosha harana chikitsa would be the ideal remedial or treatment which can be given. Excess vitiated doshas here along with small quantity of medicine leads to parisrava, means discharge. Where there is swelling, itching, skin diseases, nausea, feeling of as if wet clothes are worn, tastelessness and anemia, because kapha is increased here a lot. So in management, remove excess dosha by vamana. So here by vamana they mean sadhya vamana. Immediately go for sadhya vamana. Whatever liquid or the liquefied doshas are there, kapha dosha which is there, let it all go out of the body so that that complication is further avoided. Go with sadhya vamana or do snehan and then Vivechan. After which you can do arishtam to gain the digestive fire back. Next, what is it? It is Rudgraha or chest congestion. Now, Rudgraha, we have to be very careful here because it is one of the another pranahara marma which is important, that is Rudaya. So, Rudmarma. How does it happen? Two scenarios again. One scenario is if after taking the medicine, the person changes their mind. You know, I have taken a medicine, oh, but I don't want to vomit now. I don't want to go with Vamana. Then what happens? Definitely it will stay back. Just like how you hold your emotions and your heart starts aching. Similarly, emotions are very powerful, right? Similarly, all these Vamana Vivechan Aushadhi are very powerful. Vamaka Aushadhi is very powerful. Its force should not be held back. If that is held behind, then the heart is put under tremendous pressure. So what exactly happens? Vata gets lodged in the pericardium, giving rise to severe heart pain. What are the symptoms of it? Hiccups. All the Vata increasing symptoms. See, cough, excessive fatigue, Vata, Avruta, there is avarana of cough also in it. So too much salivation, eyes rolling upwards, the person is not able to think properly. There can also be fainting and grinding of teeth. What to be done in case of Pitta and Kapha aggravation? Of course, Vata is also causing all of these. But in case of Pitta aggravation, give Madhurahara Rasa Aushadhi, Katu Rasa Aushadhi and let the person go for Vamana. And if not, then Pachaka Aushadhi for Ama Pachana and rehabilitation of Agni. How does this happen? In scenario 2, again, if after taking medicine, there is excessive Vamana. So what do? Excessive Vata is vitiated, causing severe heart pain. Now we go with Vata Hara Chikitsa, that is Snigdha Amla Lavana Aushadhi. And in case of Kapha and Pitta also aggravated, then Ruksha Katu Pitta Aushadhi. The call of what Aushadhis you will give depends on what situation the person is in. This has to be very neatly and carefully monitored. If need be, ECG has to be also taken. If need be, the person, even before that, if the person is having any heart conditions that you know of, you have to be very, very careful, because Hridgraha can be seen as one of the complications where there is arrhythmia or there is a tachycardia or a patient suffering with previous heart disease. This was one of the complications that I've observed when I was doing my MD in Hassan, SDM College of Ayurveda, Hassan. And we did manage it by counseling the patient beforehand, consoling the patient and asking them to not hold back the urge. Even though they feel bad to vomit it out in front of a doctor and an attendant, sometimes that is why they hold it back, practically speaking. But if you counsel them enough beforehand and give them the confidence, this major complication is avoided. Complication of Gantra Graha or body stiffness. Now, when you talk about stiffness, Grahata is always because of kapha dominance, right? So look at the symptom and we all already know it's chikitsa. It's easier that way. After taking emetic medicines, if one restricts vomiting bouts, or is obstructed due to excessive kapha, then the vitiated vata causes body stiffness. Here there is avarana again. So what happens? Stiffness, pain, fainting, cramps, fatigue, tremor. And what do? Mainly vata elevating treatments like Snehana Svedan. Because stiffness is caused definitely by kapha, but it is mainly because of the avarana of vata first. So we need to take Snehana Svedana and all the vata hara chikitsa to first take down vata. Complications of Jivadana or bleeding and its management. When does this happen? When there is Mrudu Koshta, in a Mrudu Koshta person, where the doshas are less aggravated, and if a Tikshna Virechan medicine is administered. So if you go wrong first in analyzing the Koshta of the person, Ashtanga, Vyaapad has very nicely told, also Charakacharya, that you should always go with Kanishta Matra of dosha. Go with a small test dose before going with the main dose. So always do that on the patient to know the Koshta. Koshta Pariksha is very, very important. If you miss out on the Koshta, then your entire calculation goes wrong. Just like the first step, if it is lost, then the whole equation changes. Similarly happens here. So what complication is, if in a Mrudu Koshta, less aggravated doshas, if highly potent or Tikshna Aushadhi is given, then that leads to not only Vata, Pitta, Kapha, all of those elevated doshas also go, but along with that, even Rakta is gone. And that also pure functioning blood, not the impure blood. So as per our text, some tests are given, were done that time to know pure impure, which hold valid now, also like giving 2 crores to it. If they eat, it is fresh. If they don't, then it is pale. Washing the stained cloth, all of those I will not go into detail, but we will know whether it is Shuddha Rakta, pure and impure blood. If it is pure blood, that means you are losing blood. That may lead into hemolytic shock. So you have to be very careful about this. Symptoms is burning sensation, fainting or intoxication. And how do you manage that? Immediately Pittanashak treatments or Atiyoga Chikitsa is to be done. Blood transfusion is something that is to be done, that could be done immediately. And that is what even the Acharya says, that blood of any animal like deer, cow, buffalo, goat, which will sustain your blood. So that has to be transformed. Human blood can be transformed. The same blood can be used for Basti. Even Basti Chikitsa could be done here if the patient is okay and has not fainted or is okay to go ahead with Basti Chikitsa, then Bastis can be done with same blood, adding Churna of Darbha because it is Kambhaka. Basti with Shitavirya drugs and milk processed with the drugs of Shyamala, Kashmiri, Badara, Durva, Ushira. All of these are Shitavirya. Or coolant Pichha Basti. Now Pichha Bastis are very soothing Bastis. They are Kashaya Bastis. They are Shitavirya Bastis. If you give those treatments in a course of 5 Bastis soon after, if the blood loss is mild. If the blood loss is heavy, then definitely transfuse blood. If not, then go with these chikitsas and slowly it will reduce. Sneha Basti with Dhritamanda is effective. Now this is something which could be which can be made even in an OPD basis, and it can be administered. It's very easy to make, and I've been using those. The complications are not for these complications though, but in patients with bleeding disorders. Sneha Basti with Ghrutamanda is very good. If you use Sukumara Ghruta, is excellent. It depends on what condition the patient is coming from. Your Sukumara Ghruta can be used. Your even Mahadikta Ghruta can be used. These are all Ghrutas which can be used. Complications of Guda Vibramsha. Now, whenever there is rectal prolapse, imagine a patient coming to you, going for Shodhana, and there is rectal prolapse. That is the most traumatizing event a person can have. That is why our acharyas have very nicely said that first, if there is a loss of conscious or patient is not feeling good, they are almost on the verge of fainting, then console the patient with music therapy first and tell them that it's going to be okay. The main management, of course, is going to be depending on the individual disease protocols. But if Vivechan drug stops action after eliminating of fecal matter, or if hormonal recipe stops action after elimination of medicine, and excited doshas do not get properly eliminated, only then these symptoms arise. There is either prolapse, there is itching, there is first degree prolapse, second degree prolapse. But then positioning of the rectum back is very important by using Kashaya Dravyas, and it has to be manually pushed back into its own location. You can even do Dhavana with Kashaya Dravyas. That is why they have written using of Kashaya Dravyas. Stamba or stiffness, its complication and its management. So when Stamba occurs, what exactly is going on? If Snigdha Virechana Dravya is given to Ati Snigdha person, there is obstruction to Vata. And pain and obstruction leading into, again, Guda is a Marma. You see that in most of these complications of Virechana, Guda is a Marma which needs to be protected. In case of Vamana, it is definitely heart, Rudaya, Marma which needs to be protected. So Marmas definitely have a very important role to play here. So in this complication, what happens in Stamba and stiffness? There is frequent expression of little quantities of doshas. Because it is little, what you need to do is Langhana Pachana and then give Tikhna Basti or Virechana and let the whole doshas come out. If Ruksha Virechana Dravyas is given to a Ruksha and Durbala person, then also the same complication occurs. Visheshan of Vata leading to serious complications where whole body is stiffened or there is colicky pain in the lower abdomen. Okay, so in such times, of course, because it is colicky pain refers to Vata being increased on a higher level. Vatahara Chikitsa Snehana, full body Abhyangam Snehana, or at least local Abhyangam, and Svedana, that is full body Svedana, Peti Sved or Nadi Svedana should be given. Next is Kalama or fatigue without exertion. A person comes to you feeling extremely exhausted but has not passed good amount of Vegas or nothing has gone to the extreme where they are feeling fatigue. Then this complication occurs. So if Virechana Dravya is given to Snigdha and Mrudu Koshta person, then there is aggravation of kapha more than expected, which then obstructs. That means it causes avarana to pitta and vata. Then fatigue, heaviness of the body, loss of strength, and excruciating pain occurs. So how do you manage that? Give Vamaka Dravyas and induce vomiting. Because there is kapha avarana, of course, you have to give immediately. Now, which Vamaka Dravyas can you give? By my experience, it is very easy to give Yashti Madhu Fanta because it can be quickly made and given. You can even give just plain buffalo's milk to drink or Saindhav Lavana to induce immediate vomiting. Then you go slowly with Langhana, Pachana, and Snigdha and Tikshna. Shodhana later on can be planned and done. Signs of improper purification and consequences. The things that we need to remember are, if you are giving Virechana Aushadha, they are going to act only in Paripakva Avastha. That means you have to ask the person when they get up in the morning, have you passed motions? Is your sleep good? Has the previous food gotten digested? All of these things are very important when you are undergoing any Shodhana therapy. Because they act very well when there is Paripakva Avastha of the medicine and Vamana Aushadha in Apakvavastha. That is why otherwise they act in an opposite way. Otherwise, if it is Vivechan Aushadha in Apakvavastha, it causes Vamana. Vamana Aushadha in Paripakvavastha, it causes Vivechan. So Vamana Aushadha should not be kept in your stomach long enough for it to digest. At the same time, Vivechan Aushadha should not be that light that it comes out as Vamana. It should be able to go down your entire GI tract and then cause the desired effect, that is Vivechan. Ayoga, less purification. What happens during that time? The cause is the preparation of the individual, means if Snehapana is completed without attaining Samyak Snigdha Lakshanas, or if there is low quality of medicine administered. The quality is not good, it has been stored for a long time, not made properly, or if there is any mistake in Snehan or Svedana Karma, then that is when it happens. The symptoms are Vata, of course, gets aggravated, Pindikodveshta, cramping pain in your legs, arms, sometimes Tamaso Darshana means giddiness, fainting, there is blackout, or Kapha Pitta Dushti Lakshana like Kandu. So all depends on which dosha is aggravated. Treatment 1 would be revising the dosha dushti using various kriya karma, see what dosha dushti has occurred, and then go in Durvirecha due to Ruksha, Bahya Anila, Krura Koshta, they are advised to undergo Niruha Basti first. With Niruha Basti, you have to go with a little Tishna Dravyas for Niruha Basti. In Ati Yoga, excess purification, what happens? The hazards are its management. The practice of going for Vamana in case of Ati Yoga or Vivechan and vice versa is not done widely. So if there is Ati Yoga of Vivechan, go for Vamana, or if there is Ati Yoga of Vamana, go for Vivechan. Yes, it looks very compact, it looks correct theoretically. But practically, it is not always possible, because whenever there is Ati Yoga, the person is fatigued, they are extremely tired, they are all out. So, it is very difficult for the person to actually go with a different form of Shodhana to stop one Veda. So, what do we do here? It is easier to manage with Parisheka Sveda, Abhanga Sveda, and internal medicines. That means for Virechana Stambhana. For Vamana, give things which will seize the bouts of Vamana. Again, here going with opposite quality gunas are very important. Taking care of which dosha is aggravated, going with that care is important. Some preparations which can be easily administered is Bilvadi Gutika, depending on the dosage, 2 tablets morning, evening, or the size is what is important. Siddha Marka Dvaja, Dhanvantari Gutika, to take the pain down as well, fatigue down as well. All can be given. For excess Virechana, internal medicines are given. Milk processed with drugs of opposite guna are given. That means which is Tambhutva rather, which are more soothing, which are anti-pitta are given here. Pichavasti with Madhura Gana Dravya is given. Anuvasan Basti also can be given with Madhura Gana Dravya, which definitely will be Stambhana in action. Mainly for very excess Virechana, Stambhana, we have to hold back. So you have to give that treatment. And for excess Vamana, definitely Kaphara Dravyas are considered. Many emergency situations like fainting, tongue protrusion, or locked jaw, such things can happen. So you have to be very, very careful while administering Vamana. And the management is simple and quick. If there is locked jaw, try to bring it back to position. Our acharyas have given a very simple procedure of eating tamarind in front of the patient to stimulate salivation. So anything that will stimulate salivation for the person, so that their vagraha or things like that will be managed. They need to be done. Techniques like pushing back of tongue manually also could be done. And in emergency situations for both excess Virechana and Vamana, in present day scenario, if need be, definitely go with normal saline water IV. IV drip has to be given, or at least ask them to take electrol powder at regular intervals of half an hourly, and so that they will hydrate themselves first. There is going to be an imbalance of electrolytes, there is going to be an imbalance of water. So here main differences along with Ashtanga Hridaya, I have also taken first Sushruta Chikitsa and Charaka Siddhisthan. Pavan Virechan, Vyaapad, Siddhi and Chikitsa. Let's go to Marma Abhyasa now. How do we correlate? There are 107 Marmas, Mara and Deti Marma, you know. Marma is a spot where all of these good things meet together. It's a meeting spot of Mamsa, Asti, Sira, Snayu, Dhamani, and Sandhi. So where prana is present, because all of them come together, prana or they are very sensitive spots of our body where life is present, is what Bhagavatarya says. Teja, Maruta, Soma, Sattva, Rajatama, all of them comprise where at all the marma spots as per Sushrutarya. Now, when we go to Marma Vichara, has to be done while doing 5 purificatory procedures. We have to take care that whenever we are doing Vamana Virechana, Basti, Nasya, Rakta Mokshana, if you have a chart of marmas in front of you, it is much easier to understand that. Though I have covered mainly Shodhana means Vamana Virechana, Nasya, Basti, Raksha Mokshana are also very important. But if I would have gone into details of those, then I think 1 hour would be very less for this. So that is why I have covered main Shodhana procedures, Vamana Virechana. But we will talk about marmas when it comes hand in hand with the Shodhana procedures. So whenever you are undergoing Vamana, marmas which are related to thorax, upper abdomen, chest, upper neck, upper GIT, and Hridaya has to be considered. Have to take care of those. Virechana is when entire you have to take care of the marmas related to entire GIT, gastrointestinal tract, and focus on lower gut and Buddha. Basti, lower abdomen marmas, and Basti marma, Nabhi marma also. In Nasya, marmas of head, neck, face, and those with upper respiratory tract. And Rakta Mokshana, all marmas specially related to Sira and Dhamani type, which are categorized into Sira Dhamani type of marmas. They are very important when you are undergoing the Rakta Mokshana. Now let us see one by one. So these are enlisted marmas that we have throughout our body 107. When we are doing Vamana Virechana, depending on what I have written earlier in the earlier slide, we have to always have a correlation and see which marmas fall when we are giving which procedures. So for Nasya, we have to take care of front and the back. So Shiro Mukha and Shiro and Griva marma as well. Because a lot of marmas come on head, neck, and shoulders, above the shoulders, head and neck. So they need to be taken care of. What do I mean by taken care of? Whenever in pre-procedures, we are doing Snehana and Svedana, if Marma Chikitsa is also done, if marmas are taken care of while doing Sneha and Svedana, then the outcome of Shodhana procedure enhances to 10-fold. That is why Marma Chikitsa is that important. To take down the complications, bring the person's mind and body together when you are working on marmas. And the complications do not arise, or even if they arise, how do you apply your knowledge of Marma Chikitsa to take the pain level down when the complications arise? Is mainly the work of a physician. So it is classified into 5 types depending on sthana, where it is located, which marma, then nature, and then effect of injury. Also dimension, size, and number, but I'm not going to focus on that. So I've highlighted what I'm going to focus on. Classification based on site is again head and neck, 37 marmas. See, that is a big number. Urdhva Bhaga marma. Back 14, chest 9, abdomen 3, limbs 44. Whole limbs 11 into 4 is 44. Totally 117. Classification based on structure, as we know, Mamsa, Sira, Snayu, Asti, Sandhi. And also the Bhagavatas Acharya said that contribution, he has contributed Dhamani Marma 6 times, which are 9. Now what do they do when there is injury? Either immediate, they are Sadhya Pranahara, means immediately fatal. Kalantara Pranahara, belatedly fatal. Vishalyagna post extraction fatal. Vaikalyakara debilitating, or Rujakara painful. So it is in and all not a very comfortable field. I am going to mainly focus on Rudh. Only 3 marmas here, and then we will go with other chikitsas. Rudh marma. It is a Sira marma and Sadhya Pranahara marma, situated between 2 breasts, right in the center of our thorax, and present at the Amashaya Dwara, near cardiac orifice, and that is why during Vamana you have to take care of Hridaya marma, like I emphasized before. I cannot emphasize enough that Hridaya marma needs to be taken care of while giving Vamana procedure. Hence, this needs to be protected, especially while giving Marm. If Dashadhamanis are considered, then these 10 vessels can combine together to be called as Dashadhamanis. Gudamarma. It is attached to the Sthulanthra. Of course, it is the last part of Sthulanthra, a large intestine. It serves as passage to Vata and Mala. It is Sadyopranahara. It is Mamsa or Dhamani Marma. And the anal canal along with the anal sphincter within the vicinity of Panitala Marma is identified as that Marma, as Guda Marma. So it is a bigger area. Sudden stretch might lead to shock. So when does this happen? Either while the bouts are coming out in case of Vivechan, when you are administering Vivechan, there is perikartik or srav or such things, then this marma can be affected. Very, very important thing is asking the person if they have had history of piles, fistula, fissure, or any other abnormality related to the region of Guda is extremely important before starting with Sanshodhana procedure, so that you are protecting the Guda marma here. Now this is during Vivechan. What happens during Basti when you're practically when you're actually pushing a catheter in with the syringe? Then if the catheter is not oleated or the Guda is not oleated with a cotton swab, then definitely that might lead to shock. So if there is certain stress, then that might lead to shock because of the Basti Dravya entering, or even the softer or any object which is to be administered, like the catheter or anything, that might lead to shock or per rectal examination. So that is why this can cause shock and even death. Basti Marma, situated in Kati Pravesh and made up of bladder and its appendage. So Basti Marma is again a bigger concept. Of course, not just Basti, but also its appendages. The entire urinary system, we can say that. It is Sadhya Pranahara again, and it can be fatal except during the extraction of Ashmari. Here, you have to be very careful while removing the calculus. It is a Snayu Marma, and it is less Mamsa Rakta and performs more as a function of preservation of urine. Marma and its current application in Panchakarma. Now, what therapies can we do so that marmas are taken care of while doing Panchakarma? Methods of marma therapy are massage and energy methods, herbal methods, and use of instruments. Massage and energy method means abhyangam, or that is called as massage, using various forms of pressure and movement with the hands or on other parts of the body like the elbow and the feet. This is aided by applying heavy oils like tila tela or medicated herbal oils, not only just to massage but also used as an oil therapy. So when I was in California and I did this massage therapy and health educators course, we had reflexology lessons. We had lessons where your energy channels are activated. In Chinese medicine, there is yin, yang, and qi, and those are also energy paths. Similar, our Eastern sciences go very hand in hand. So similar, there are also same spots like we have on our marmas on our body, which need to be slowly stimulated in order for the blocked energy to be released, or if there is over release and exhaustion in those points, then the energy to come back and nourish and fill those spots with balance. So now that is the technique here. Aromatherapy, again, using aromatic oils can be useful, like lavender, sandalwood, camphor, along with abhyangam. Mardana or acupressure. Now, acupressure is actually the technique where we, even while doing marma massage, marma point therapy, we do acupressure, or we apply slight pressure. Now, this pressure is so slight, it feels as if you have kept 1 rupee coin on your skin. That's slight. The pressure. It should not be very hard pressure at all. It should be just enough for you to stimulate the marma. There is another method which is called as Chahutti Tirumal. That means Padaghata, or means massage by foot pressure. I was very fortunate enough to have a visual, to have a demonstration scene done in SDM College of Ayurveda, where this is mainly a method used in Kerala, where practitioner's feet is used to generate pressure and strokes all over the entire body. It not only works on physical level but also on psychological and emotional level. Here both the patient hand cannot be durbala. They should be having a good body also in order to bear the pressure. And a very skilled physician only can do, or a skilled massage therapist only can do this practice. Marma Abhyanga. Again, why they're doing Snehana Svedana? Definitely do Marma Abhyanga as well. Kalari Marma massage is also a type of massage where the vital points of our body are stimulated using oils, performed by therapists using either hands or the feet, applying appropriate pressure to specific parts of the body. Here what happens, back pain and stiffness is reduced, and it also stimulates various bodily organs and systems. Benefits of massage. Among lots of benefits, the most important that I want to highlight here is lymphatic, vascular and nervous system stimulation. So it increases lymphatic drainage. So whatever toxins are in your body goes out. Your channels are cleared. Vascular system, it supplies more oxygen. And nervous system, it improves tone and sturdiness of our cranial nerves and spinal nerves. Other treatments of Ayurveda which can work very well in Marma Chikitsa involve, along with Abhyanga Snehana Svedana, Physical and Kili treatment. So Kili treatment or Kizi, but spelled as Kili treatment, is a therapy wherein herbs are filled. It's made into potli, fried and wrapped in muslin cloth and tied into a bolus, and a frying pan. Use a frying pan for the potlis and dip it into oil and use all of the body. Now, along with this, there are specific fingers and wrist and palm pressure that is given in order to enhance its effect. So, according to the regime of Ayurved's Panchakarma, of course, there are two Purva Karmas, Snehana and Svedana. Bahya and Abhyantara, both are very essential in order to do Marma Chikitsa. For Marma Chikitsa, Bahya Snehana is carried out along with Svedana. Herbal methods like Upanahas, let us come to Lepa first. So Lepana, where Lepana? At the spots of Marma, around the Marma is very good. It can also be practiced. Use of herbal paste like sandalwood, turmeric, ginger is used. Herbal treatment means what? In the form of Upanahas, that is poultice, or just taking powders in different Upanahas. We stir fry the powders and make them into potlis and then use it. Dried can be used. Some medications internally given and externally. One is Marmani Gulika. You can use it with water, definitely scrub that down, you make it into a paste and apply it externally. Also can be used. Muruvinna tail for tail abhyangam. Prasarani tail, Jirakadya tail, Nagaradi tail, Mahanarayan tail. One of the most easiest available and thoroughly used worldwide is Mahanarayan tail. As for pain to go down. All kashayas and tailas mentioned in Vataroga and Vatarakta Chikitsa. Use of instruments, which also can be done. This is Sira within bloodletting. Piercing of vessels, particularly bloodletting or bleeding from Marma points. They are not exactly on Marma points, a little away from the Marma points is what it means. Suchi karma or acupressure, acupuncture, piercing of small needles, including puncturing of small vessels at Marma points. Here it is near the Marma points. Agni karma or heat application. And Kshara karma is also done near the Marma points. How do you take care of Marma? The most important thing is Abhata Varchanam, Nityam Swastavrittasya Anuvartanam, and Utpannati Vigatanam, Marmanam Paripalanam. It is extremely important that we prevent. Prevention is better than cure. You are taking good necessary Paripalana is done of Marmas, according to Charaka Siddhi. Practical points to remember from this presentation are: the researchers have shown that Vata type of people respond best to Marma Chikitsa, Pitta and Kapha type respond to medications as well as Marma Chikitsa. At present, Marma treatment is available only in Kerala mainly, and they are done in Kerala. The system takes 8 to 10 years to learn the basic principles: healing, massaging, increasing physical flexibility. When marmas are affected or ruptured, the organs linked with prana channels become starved or lack of prana, which leads to some organs becoming diseased, crippled, paralyzed. So this is the principle behind it, slowly causing death. That is why you need to protect marmas. Protect Sadhya Pranarma with paramas that you know with utmost carefully while doing Shodhanartha Panchakarma procedures. When in doubt, back off. Whenever you know, oh, there is something which is going wrong, back off rather than going ahead with it, because that will further lead to complications. Observe, analyze, and then only proceed. Doing Marma Abhyasa will give a different and clearer perspective while attending Shodhana Vidhi Vyapad to ensure safety of the patient as well as achieve the right Samyak Lakshanas and avoiding Vyapad in the first place. And always take an expert second opinion in critical or sensitive cases, because every case is new. You never know what complication is going to arrive when. Whenever you see the complication, take an experienced hand's opinion better than your own, because two brains are better than one. So that will save the prana of the person, the patient. Thank you. I think I'm in time, completing in time. Thank you for listening.
Thank you very much, Dr. Devika Deshmukh, for your very detailed description on Sanshodhan, Karma Vidhi, Nishedh, Vyaapad, and Marma, Vichar, Vivechan, that is complications and management of Panchkarma procedure, treatment and the way out of it. We are very much thankful to you. Now over to Dr. Vinayak Tade sir for your comments.
Thank you.
Okay, Dr. Tade sir, please unmute yourself.
थैंक यू देविका देशमुख। आज आपने संशोधन विधि निषेध व्यापद एवं मर्म विचार, इसके ऊपर आपने जो अपने विचार रखे हैं बहुत ही साइंटिफिक है, बहुत ही अच्छे थे। हमारे स्टूडेंट्स के लिए, टीचर्स के लिए बहुत ही महत्वपूर्ण है। कौन से रोग में संशोधन कर्म का निषेध बताया गया है? हालांकि बात यह है, अगर हम करेंगे संशोधन कर्म तो कौन से व्यापद निर्माण हो सकते हैं? तो इस वक्त वो व्यापद निर्माण नहीं होने चाहिए, कौन से मर्म का विचार करना चाहिए। बेसिकली राजयक्ष्मा में पंचकर्म नहीं करना चाहिए ऐसा लिखा हुआ है। प्रकार के जो राजयक्ष्मा बताए हैं उसमें से 3 प्रकार के राजयक्ष्मा में पंचकर्म नहीं करना चाहिए, एक प्रकार के राजयक्ष्मा में करना चाहिए। यानी विषमाशंजन्य राजयक्ष्मा जो है इसमें हम पंचकर्म कर सकते हैं, बाकी साहसजन्य ये जो बाकी की जो राजयक्ष्मा है उसमें नहीं कर सकते। क्यों नहीं कर सकते हैं? क्योंकि उसमें धातुक्षजन्य वात प्रकोप होता है। विषमाजन्य राजयक्ष्मा जो है उसमें मार्गारुधजन्य राजयक्ष्मा वात प्रकोप होता है, क्योंकि कफ प्रधान ही दोषेस्तु रुद्धेषु रसवर्त्मसु, कफ प्रधान होने त्रिदोषों में प्रधान के कारण सभी प्रकार के धातुओं में अवरोध निर्माण होता है, वह संगात्मक विकृति होती है। और उसी लिए पेशेंट का अवस्था देखकर, क्योंकि शास्त्रकारों ने कहा है कि हम राजयक्ष्मा में पंचकर्म कब करेंगे? दोषाधिकानाम बलानाम वमनम शस्यते स विरेचनम। तो इस प्रकार की जब अवस्था रहेगी तो हम वमन दे सकते हैं, लेकिन सिर्फ विषमाशंजन राजयक्ष्मा में ही कर सकते हैं। अगर गलती से हम एकादश रूप राजयक्ष्मा, षडरूप राजयक्ष्मा, त्रिविध राजयक्ष्मा या साहजन्य राजयक्ष्मा में करते हैं तो धातुक्षजन्य वात्रों को निर्माण होकर पेशेंट को व्यापद निर्माण हो सकते हैं। और इसी प्रकार के अवस्था में हमें उस वहां के मर्म का भी विचार करना चाहिए। या अगर हम इस प्रकार के अवस्था में अगर हम वमन देते हैं तो वहां के सद्य प्राणहर मर्म, कालहर मरण मर्म काल प्राणांतर जो मर्म है, इसमें कुछ डिफिकल्टी निर्माण होती है क्या, उसमें कुछ उपद्रव निर्माण होते हैं क्या, इसके बारे में हमें विचार करना चाहिए। तो ऐसी जो बात है, ये बात हमें ध्यान में रखना चाहिए। आज आपने बहुत ही अच्छा प्रकार का व्यापद के बारे में बताया है। मुझे अच्छा लगा है कि तुमने लास्ट में 3 मर्मों के ऊपर जो फोकस किया है, हृदय, बस्ती और ये गुद, हाँ, इसको कैसे संभालना चाहिए, उसकी केयर कैसे करना चाहिए, इसके बारे में आपने जो विचार व्यक्त किए हैं, इसलिए मुंबई वैद्य सभा और महाराष्ट्र आयुर्विज्ञान विद्यालय से हम आपके
और उन्होंने मैडम ने मर्म का जो पूरा डिस्क्रिप्शन करके जो चार्ट बनाया, दैट चार्ट वाज रियली एक्सीलेंट एंड इट्स वेरी यूजफुल फॉर द स्टूडेंट्स टू, आई थिंक.
Dr. Devika, will you stop your screen sharing?
Yes, 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 sir. Okay.
Dr. Shamsama, would you like to say something?
It was good lecture to listen, as the Dr. Tade sir explained about her lecture. I had 2 questions. One, not related to this main karma, panch karma, related to purva karma, because that is also basic of this panch karma. Snehan Svedan we do before the procedure, main procedure. I would like to listen from Dr. Devika, what should be done when if the Svedan is given in excess, or that dehydration occurs, or that patient becomes unconscious. At that situation, what should be done? Or prior, what should be precaution we should be taken?
Sir, we had faced this complication in SDM College of Ayurveda when I was doing my MD. This was rather one of the most common complications.
Yes.
So, 2 preventive things need to be done in order to avoid. Whenever the person, if they are taking a sitting Sveda, that means Svedan is taken in a posture where they are sitting down and Svedan is applied below the neck, then taking a cotton, a pad, dipping it in water and keeping it on the head region avoids the body's heat to go in the head, causing fainting. And second thing is, if the patient is lying down and taking peti Sveda, where only head and neck is out and the body is lying down on the table, then putting in lotus leaf or something as big as a lotus leaf, applying cooler like aloe vera gel or even a cooler cold water even to that and putting it in the region of heart, then putting a mesh of cold towel on it, definitely leads to lesser dehydration, lesser body getting heated up, and avoid complication which is fainting or dehydration in case of Svedana Karma. Again, Svedana Karma is something that the patient usually likes to get. Majority of them used to like the feeling of warmth. So they sit for longer time. So seeing the bulk of the patient and then telling them, asking them that after you sweat, come out, but don't stay there for long. Definitely takes care of it.
And what instructions would you like to give before coming that patient? Before appointment is. When you give appointment, so what instructions will you give? Should
So
have breakfast, something like that. Because these are very minute things, but they are really useful.
Yes, yes. So the instruction is not to have anything for tummy full 2 to 3 hours prior to coming for the treatment. Definitely not coming extremely hungry, but the previous food has to be digested, keep 2 to 3 hours in between the gap, and then only come for taking Svedana. And also hydration is very important. So what we give, sir, is usually after Svedana Karma, when the patient comes out, we'll give them a Ayurvedic kadha made up of just a herbal health drink, just normal kadhas. We can make that. It's very easy to make and give, so that the hydration also occurs.
And during the procedure, can you give that?
Post Svedana, sir. Yes.
Okay. Not
Yes.
during that.
Not during. Post Svedana. Warm kadha is given.
And second question related to that fatigue. Without exertion, fatigue is there, and already fatigue person comes to you. So there is any difference in management of those?
If already fatigued person is coming, then definitely we have to first go with pachana, langhana deepana pachana, so that the fatigue factors comes down. And going with brahmana chikitsa is important even before starting the shodhana chikitsa. So shodhana complication klama is different than a person who is already fatigued.
Yeah.
Yes, so that is how we can handle that.
Okay. Thank you, Dr. Devika.
Sure, sir. Thank you.
Thank you very much, Dr. Shyam sir. Dr. Pradeep sir, would you like to say something?
I would like to say thanks to Madam, because summarizing entire Panchakarma in 50 minutes is very difficult task. It's only possible because her experience. So what we experienced today, so while doing this Panchakarma, what she is having problems and how he has made new ways for the problems. So this was the uh, thing which we are finding from the faculties for the better understanding of the Panchakarma in the interest of larger population, student and teachers who are listening this session. Uh, uh, I would like to share one slide that is guidelines from Department of Ayush, Government of India, CCRAS, because the information of Panchakarma, it is discrete in our all Sanhitas, Lagutrai, Bharatrai, but this landmark document has been released by Department of Ayush, CCRAS, Center for Research in Ayurvedic Sciences. So I think this document is visible to all of you.
Yes.
Yeah.
Yes, so this is the practical handbook of Panchakarma procedures. So the chief editor, of course, Professor Dr. J.S. Vivechan sir from Podar Medical College. He was that time Director General for CCRAS. And this document is very important. Why I'm showing this document? Because as a practical purpose, the person who is intended to start his new Panchakarma center. So what exactly size of Panchakarma center should be there, what manpower, what infrastructure, that all information has been summarized, and that too every information with relevant Sanhita references. Like here you may say the Snen Svedan. So for every statement they have given the references, and in the last part they have given the what infrastructure um, uh, uh, is essential, manpower, then the specification of the Panchakarma theatre. So like Panchakarma is like an operation theatre. So this practical information is available on CCRS website. So the students and faculties who are intended to start their Panchakarma center, the entire document is around 90-page document and well explained document which help the students and teachers to start there and to upgrade their centers. Because why this is important? In nowadays, Ministry of Ayush has been collaborated with Quality Council of India (QCI), voluntary certification of the wellness centers. So this is ultimate document, reference document. So when you are going to start your international, because today's faculty is international faculty, I would say, because she is having experience not only India but abroad also. So if you want to have your state of art international level Panchakarma center, so these are the benchmarks for the establishment of Panchakarma center. So this will help to recognize or accredit their centers with Quality Council of India (QCI) for the better spread of Ayurveda knowledge entire globe. So with these small notes, I will stop here. Over to you, Vinod Mehta sir.
Thank you, Dr.
Thank you
Anand
very
sir.
much, Dr. Pradeep sir. I would request you to kindly, if you can send this book through WhatsApp.
Yes,
And
I
one
will.
more thing, in 2 lectures back, you mentioned.
Correct. I will share this document.
Yes, sir. So we can distribute among all of us.
Correct. Yes.
Exactly. And sir, one more document that last time, 2 times back, you had given a criteria for the data collection for the patients. So if you can,
I will also share that.
So that also we can circulate.
Correct.
Very good. Thank you very much, sir.
Okay.
And does this
Thank you once again,
Panchakarma
madam.
center requires FDA permission?
No, not FDA.
Sir, this Panchakarma center requires no FDA.
No.
Or with the drug controller?
Yeah, but this is the volunteer certification program of Quality Council of India, QCI. Like we have product, our product is ISI mark. So this is a quality norm which is acceptable at global level. Suppose you are sitting in Mumbai and you want your patient from America. So if your center has been recognized by, accredited by that center, so your center will be displayed on that Incredible India website, which is Department of Tourism, Government of India. So this Foreign External Ministry, then Tourism Ministry, and Ayush and Quality Council. So this is very multi-ministry program. So your center can be visible to the all external foreign external affairs ministers website of America and all the, because they will recommend that this is the gold standard center, and you can because they will never approach Vinod Mehta as an individual person, but the ones Government of India will accredit it as a wellness center from QCI. So you will be benefited for getting international patients in your Panchakam state. So that is the only motto for that accreditation of wellness centers.
It's very good initiative by IRC. Very good. Thank you very much. So friends, on behalf of Maharashtra University of Health Science and Mumbai Vidya Sabha, we are very much thankful to Dr. Devika Deshmukh for her wide knowledge on Panchakarma and its complications. And friends, we hope to see you all tomorrow to listen Dr. Vinayak Tagde sir with his subject Mans Janamatu, Sanshodhi Shastra, Ksharagni, Karmana, Chikitsa Siddhanta Vivechan. So thank you very much everybody for listening us and joining us, and hope to see you all tomorrow at 3 o'clock. Thank you very much. Namaskar.
Thank you. Thank you, everyone.
Thank you.
Guys, झालं का फायनल ते?
नाही अजून चालू आहे, रेकॉर्डिंग चालू आहे, लाईव्ह पण आहे, रेकॉर्डिंग
लाईव्ह चालू आहे.
जस्ट रेकॉर्डिंग बंद होत नाही आहे.
रेकॉर्डिंग बंद झाली, लाईव्ह चालू आहे.
हो. सचिन सर, सचिन सर लाईव्ह बंद करता येईल का सर?
Otherwise, everybody should leave.
Yes, that is the best option, because that.
It has stopped.
Yes, so we will leave, sir. Okay, I will end the meeting. Okay.
Yeah.
Thank you very much, Tagde sir or Shyam sir.
Thank you, Dr. Vinod bhai.
Yes, we will meet tomorrow again.
Yes.
नहीं प्रदीप सर एक बात करना है. श्याम सर और ताड़े सर को बोल रहा हूँ कि आपके गाइडेंस में और भी क्राइटेरिया तो अपने पास आ ही गया है, तो एक परमात्मा के नाते एक अच्छा आयुर्वेदिक पंचकर्म सेंटर बॉम्बे में हम शुरू करना चाहिए.
Yes.
Definitely will guide us. Yes, definitely. चलो, thank you very much. Thank you. See you tomorrow. Bye.
Thank you.
बंद आहे ना.
Hindi ko